Hello everyone. This presentation is on Huang, also called an amarina, philodendron, and Rhythmania pill. It is on the California Acupuncture Board herbal formula list. I will briefly review the traditional pattern, a hypothetical patient, 3 possible drug-herb interactions, and a practical management plan. The goal is to connect traditional Chinese herbology with modern medication safety in clear student language. Traditionally, Huang belongs to the category Nourish Yin. A representative pattern is kidney yin deficiency with deficiency heat, night sweats, and tidal fever. Important ingredients include Shu Dai Huang, Shan Zhu Yu, Shan Yao, Fu Ling, Mu Dan Pai, Zi Zai, Yai Mu, Huang Bai. In practice, the formula should be chosen by matching the full pattern, not simply by matching a biomedical diagnosis. I would also screen for red flags, confirm that urgent medical care is not being delayed, and review all medications, supplements, and over-the-counter products before recommending treatment. My hypothetical patient is 58-year-old man with night sweats, dry mouth, and deficiency heat symptoms. The current medicines are metformin, tacrolimus, hydrochlorothiazide. This case gives a possible reason to consider Huang, but it also creates interaction questions. I would document tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about kidney or liver disease, bleeding history, pregnancy status when relevant, and prior reactions to herbs or supplements. Medication reconciliation is essential because many clinically important interactions come from the combined physiologic effect of herbs and pharmaceuticals. Interaction 1 is Shu Dai Huang/Imu plus metformin. The mechanism is that several ingredients have glucose-lowering signals that may add to diabetes therapy. The clinical significance is moderate in susceptible patients. My management plan is monitor glucose more closely during initiation. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 2 is Huang Bai plus tacrolimus or CYP substrates. The mechanism is that philodendron contains berberine-like alkaloids that may affect metabolism and transport. The clinical significance is potentially important with narrow therapeutic index drugs. My management plan is seek pharmacist or specialist review before use. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 3 is formula plus diuretics. The mechanism is that some patients may experience GI upset or altered fluid status, which can matter when a diuretic is already used. The clinical significance is usually low to moderate. My management plan is monitor hydration and medication tolerance. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. In conclusion, Huang may be reasonable when the patient truly matches the pattern kidney yin deficiency with deficiency heat, night sweats, and tidal fever. The safety question is not whether herbs are simply safe or unsafe. Risk depends on the specific ingredients, the product quality, the dose, the treatment duration, the patient's organ function, and the medicines being taken. I would start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is educational and does not replace individualized medical care. Thank you.